Okay, so one of the scariest things that can happen when you're just doing your general training, there's no live fire going on, people aren't really supposed to be getting hurt, is a heat casualty. Because if you're getting into heat casualty territory, you're already likely out in the field, you're away from real definitive care, it's not likely to happen right outside the door of a hospital. And so it can be a very nerve-wracking thing because it's serious and you can end up with some very serious problems. You can have organ damage, you can die from overheating. And so let's talk about some ways that people can work on trying to handle that issue, right? First of all, I'll include down some links below. If you are curious about how the military deals with this, there is actually a pretty reasonable and easy to understand wet globe temperature, so a category for how the Army classifies how hot it is. And there are suggestions for how much fluid you should be taking in and when you should be doing work rest cycles, because working 10 hours solid with no breaks in 105 degree weather is a great way to end up being a heat casualty and having a heat exhaustion or stroke. It's a thing that can really hurt you. So I'll include that below. And one of the things you can look at there is, hey, depending on how hot it is out here, what are some reasonable objective limitations I should be thinking about? Am I getting enough work and rest? Am I getting enough fluids to try and give my body a fighting chance to not become in a dangerous place, right? One thing to think about is, as hydration is an issue, is pre-hydrating. If you know that you've got a really significant physical event, whether that's a field training exercise, whether you're going to be deploying, whether that's a hiking trip, whether that's a race, whether you know, hey, I'm going to be working out in the sun, doing some yard work, laying some sod, or whatever it is you're doing this weekend, one of the things you want to think about is starting hydrated. And the way I tell most people to talk about controlling their hydration at home is just literally look at your pee. If your pee is light yellow to clear, you're probably pretty hydrated. And if you're starting to push like darker yellow to orange, you are pretty dehydrated. Things that tend to dehydrate people, lots of soda, lots of coffee, lots of tea, things that tend to hydrate are things like your sports drinks and your water, okay? So I would suggest transitioning more of your fluids to the things that hydrate you, your sports drinks and your water, and maybe increasing the volumes of that until you start seeing that your pee is starting to be a little bit clear. That is a goal that you should have during your events, after your events, and before your events, okay? So don't wait until you're already hot and have been out in the sun for 4 hours to start thinking, I should probably hydrate more, because you're already behind at that point, and you don't want to get behind with this. Another thing to think about is when you're talking about taking in large amounts of fluid, large amounts of water, just water, can actually be dangerous for you, right? Because your body is a complicated bag of chemicals. If you're taking in just water, the sodium, which is an important chemical for how your body functions, can get really dangerously low because as you're sweating, you're constantly losing sodium. So as you take in a whole bunch of water that doesn't have any, your body can get dangerously low in sodium. So it's one of the reasons that it's important to think about using some rehydration electrolyte fluids. So that's sports drinks. In the Army, we use something called drip drop a lot. One thing I do want to mention is somehow a couple people around me had heard that you could only drink 1 drip drop per day, and somehow it was dangerous to do more than that. That is not true. That is literally on their packaging now. I don't know, maybe there was some old formulation that was that way, but you can have multiple doses of this. And so what I tend to suggest to people is at least every other or every third canteen of water should probably have some sort of like hydration fluids in it. And if you are doing that, and you're actually eating your food, particularly if you're eating, CK food from the military, if you're eating MREs, you'll get enough sodium and you should be fine, right? But you don't want to be drinking 70 bottles of water without some sort of sodiums or something like that, like some sort of like electrolytes, because that can be dangerous to you. Now let's talk about how to handle your heat in general, okay? Ways to dress. The lighter fabrics that you can wear if you're going to be in heat, the better. It is actually considered often a little bit better to actually have some sort of fabric on you, because then you can have that fluid as you start to sweat can hold against your skin a little bit. So some folks find that they're much more comfortable if they have a little bit of light fabric on them. I know that when I invested in some hot weather camos that I found that was significantly, hot weather ACUs, they're much lighter and they breathe better. Man, did it really change the quality of my life when I was out in the heat, when I was wearing a hot weather uniform as opposed to a regular. So if you have the freedom with your command to wear a hot weather uniform in the heat, your life will be dramatically better. They're just much more comfortable, and your temperature should probably reflect that, right? So that's an important thing to think about. The other thing is look at if your heat category, wherever you're at, or if you're hiking in civilian universe, the ability to blouse your boots, let some airflow get going in there and not have everything all tight and tucked into each other. I know that for the goals of like tick control and stuff like that, we often want to like tightly pack things in. But if your issue is heat and you're trying to make sure that you don't overheat, you have to kind of weigh those risks of tick versus overheating and maybe get some airflow, because that might actually be a more important thing for you at the time. The other thing to think about is shade. Shade doesn't get enough credit. I have seen people, when they take their breaks, just sit down where they're at or stand around where they're at, and they're still standing in the sun. And that is not something you want to do. You want to make sure that you get to the shade whenever possible if you're trying and avoid a heat exhaustion problem. The other thing to think about is, and this is a problem that actually exists in the military universe, that exists in the manual labor universe. It's the, and it exists in men and women, but I think we'll just use the phrasing tough guy, right? Trying to be the tough person who doesn't let the team down can end up hurting people. Because what often happens is, for fear of being the first person to speak up and say, hey, Sarge, I'm not feeling right. Hey, guys, or team, I'm not feeling right. Hey, officer, I'm not feeling okay. Something's wrong. I'm getting a little lightheaded. I'm getting a little dizzy. Hey, I've noticed I haven't been sweating as much. My urine's been getting really dark. I'm just not, like, something's wrong, right? Very, very, very few cases in life are so urgent that it would be inappropriate to say, hey, I physically need to take a break, and I need to make sure I'm medically squared away, right? Even within the military, most situations are training and are not life and death where you physically have to keep going for the next 30 minutes or people die, right? Usually you are in a situation where if you speak up, your team can cover down and take care of you and make sure that you get a chance to get the rest that you physically require to be safe, to get the cooling, get the medical attention that you need to be safe. And I think it is important that you start to act as your own advocate and tell people when you feel wrong, okay? Because too many people don't, and they wait until they pass out, and because they're trying to be tough and they're trying to do their job, and I appreciate that. But then somebody has to pick you up off the ground, and we're ice sheeting you in a medical tent because you got way overheated. And in some of those cases, some of them, if they had spoken up ahead of time, we might have been able to try and avoid some of those problems. So I think it is important to look out for your buddy and to look out for yourself and point out when something doesn't seem right so that you can get the medical care you need. Because heat stuff is very, very dangerous, right? You can literally damage your organs. You can literally die. This isn't just a thing like, oh, I got hot and I missed a day or two of work, right? Like, this is a literal life-threatening thing. So it's important that you take care of yourself and try to avoid the heat injuries that can happen, okay? So please be safe out there. Ask some questions below if you have them, and we'll try and give you the information you need to be safe.